5:34, we will begin our Drug and Alcohol Commission meeting on Wednesday, June 2nd. Right now, I'm going to call this meeting to order. I've already taken a roll call. I am doing double duty and helping Mr. Walls with our secretary and doing the secretary duties. Please let me know so that we can ensure that that position is completed and fulfilled. Mr. Walls, did you receive any public comment? Notes from?
I have not.
Thank you. Had been sent, and I will go ahead and entertain either discussion, correction, revisions, and or approval of those minutes. I don't think that the May 5th ones were sent. We didn't even have a meeting for May 5th. So the only minutes, and just a correction on the agenda, it is March 3rd where we have the minutes. So please review them if you haven't been sent to your email. If not, you may make a motion.
Motion to approve.
Reading the minutes as written.
Aye.
Thank you. Any opposed? Okay, motion passes. Minutes approved as submitted. Thank you.
No, ma'am, it still continues in the same place that it was last month, where we're basically just waiting for construction and stuff like that. The city continues to work with their contracted consultant in order to make sure that once it's open, it is successful. But I'm sure next month we'll have something to report.
Is there anything that the committee members are able to do or have an insight, anything else? Or is that pretty much just taken care of by the city and the county right now?
Right now, it's just between the city and the county.
Got it.
I do believe that, Colleen, and once we get the program up and running and everything's ready, I believe the committee consult with their experts and whoever is going to be recommended and everything else. In the meantime, once Mr. Walls, start working on the second phase, which is a residential facility. But, so that we can get that ready and we can have a presentation so that the same people that are working on detox can put a bid to do that part, because it would make sense. So
take note of it. And actually coming up is the work group reports, kind of stated that you are overseeing, which brings me to that. I did send out an email last, like 2 months ago, and I received very little to no responses. And subcommittee and that meetings can take place. So I kind of wanted to put you all on the spot. Mr. Hernandez, I have you for, I think, the detox transition. Are those the two subcommittees that you are still wanting to participate in?
yes, and my best available days, because the normal, I mean, I'm close to 50 or more clients a week. And so my best maybe at 4 afternoon, I'd be willing, so the committee members, whoever wants to join us, we could be doing a combination of both. So I 4 o'clock, I could move them around to block my Monday afternoons off. Monday from about 4 to 6 would probably be good, because I have drug court usually goes till my staff needs to go until sometimes 3:45 or 4. So after 4, I'm pretty good. and every day.
Okay.
So that would be a good time for me.
Okay, got it. Uh, I want to say,
It would be
actually,
the detox and the mental health, both of those.
okay, but Ms. Nancy. Ms. Nancy, I have you under intervention, treatment, rehabilitation, and
Yes, yes, that's fine. Thank you, Colleen.
for both. Okay, got it. Mara, I have you down for prevention, outreach, education. I have you down for intervention, transition, aftercare. Do you want to be included in all four of them?
Sure. Let me
I know.
so let me just review. Let me, I guess, have the computer in front of me, review them. But yeah, I'll definitely narrow it down and not be such an overachiever.
Okay.
Oh, you.
I know you're the example, but yeah. Okay.
Yeah. I'll
Okay.
email which ones I'll stay on.
Okay, perfect. I have Ms. Anna on the detox transitional support. Is that something that you're still willing to be a part of, Ms. Anna?
Yes, ma'am.
And just that one?
And mental health.
Okay, perfect. Then let me go ahead and I think what we may have to do, Jesse, if it's okay with you, we may have to do detox, transitional support, and mental health since we have pretty much the same individuals participating. That way we can narrow it down to 2 tasks in one.
As when we're talking about the mental health, a lot more is just educating people. We talk about how we're going to do certain things. And so I think all 3 tasks can be done on Monday if people are willing to join me.
Okay, perfect. I think that that's probably what's going to work out. We have Ms. Veronica. Ms. Veronica, you are not on any of the work groups, but is there anything that you would like to be included in? We have prevention, outreach, education, intervention, treatment, rehabilitation, detox, transitional support. Ms. Marta, I would like to ask you as well, are you interested in being a part of any of the work groups?
Absolutely, Ms. Colleen. Please include me.
Okay. Is there a preference in one of the groups? Prevention, outreach, education, intervention, treatment? I didn't include both of you all on there. Ms. Laura, hi, how are you?
Hi, hold on. Here, can you hear me?
Yes, I can hear you.
Hi, Colleen. Doing well, doing well. Hi, everybody. Let me see.
Ms. Laura, we have you under prevention, outreach, education, and let me see what else. I think that's that. Are you anything else or any other committee that you want to be a part of?
For the moment, no. I think I'm okay with those, Colleen. And then as things develop, I'll see if I can, help out in any other.
Thank you very much. Ms. Rayo, you're here representing the media, correct? Or are you here for a different capacity? Yes, okay. So I won't ask her unless you're interested in wanting to be part of any of the work groups. You're more than welcome to help it. Ms. Moreno, how are you?
There we go.
Okay, perfect. Congratulations. Mara did inform us that you were officially appointed to the commission. So congratulations and welcome to the direct participate in any of the subcommittees.
I wanted to do the outreach since that's what I do in the school, so I would like to keep that.
Okay.
That's okay with you.
Awesome. Okay, so then I have Marina. Outreach education. Under intervention, treatment, rehabilitation, we have Ms. Nancy. Under detox, transitional support, and mental health, we have Mr. Hernandez, Mr. Montemayor, Ms. Aftercare, we have some names, but they are not present, so I'll reach out to them. And if anybody's interested, more than welcome. Sure that we're getting together and that we're doing part of what our mission is, and to be able to be proactive and produce choose leads for everyone, and then hopefully for the next meeting, each you all have plans or what we need to bring up to the city and the county for discussion, if that's okay with you guys. To be part of any of the work groups, or as always, be able to advise and give us information relevant to the Laredo Police Department.
I can be of help with, reach out and I'll be able to help in whoever asks for it.
Okay, thank you. And I'm going to go ahead and do an update on the membership forms, and that way we have a list of all the new subcommittees and the members. Mr. Montemayor, did you have a question?
No question.
Okay, thank you. If there are no questions or any other further discussion, we'll go ahead and move on to stakeholder agency updates. We do have some stakeholders present at this time. Would you all like to state anything that your agency is doing relevant to Ms. Veronica Jimenez, Ms. Ramirez, Ms. Ana? Would you all like to state anything? Do you all have any comments?
Hi, Colleen. This is Dora. Currently, right now, we do not have anything other than all our prevention programs are still providing services. You know, it's ongoing. And, we're going to be going out more to the community and doing our community-based education, which is giving out information about program services that are out there, along with the resources and alcohol, tobacco, and other drug information to parents and youth. But other than that, no, our agency is moving along, trying to meet our goals and, get those numbers going before the end of the year. But no, currently, everything's moving along.
Thank you very much. And I actually scan for actually doing an excellent job in having to put out that information to the community. I know that there was a tobacco awareness month and a couple of other tasks that you all were able to do. They were very successful. So congratulations on that. And thank you so much for continuing to educate our community.
Thank you, Colleen. I just want to mention that we are recruiting youth coalition members. If anybody knows somebody that's in high school and wants more community service hours, we are recruiting more teenagers to be part of our group, and they get volunteer hours, and we're doing different things. We're gonna offer a summer camp for them. It's gonna be virtual, but I'll have more information later on, because that's gonna be probably like in July or August, like probably July. But we're working on that.
Okay. And any information that you may have, feel free to send it over to my email or Mr. Wall's email. That way I can be able to post it up on our Facebook page. I do post some of the stuff that you've sent before on the Webb County Community Coalition meetings, and I post it up there because it's relevant to our missions. Popsicles that look very delicious, but they have alcohol, so that may be a little bit confusing for most, and it may get into the hands of the wrong people. Ms. Veronica, do you want to share anything on that?
Thank you. Yes. Well, with summer, we sent it like a few weeks back, but with summer around the corner, right? It was like we were trying to get the attention of parents, that there's these popsicles out there that contain alcohol, and like you said, kids might get into it thinking that it's, like we used to call them boys, right? And get it and eat it just because it looks very attractive and it looks like a popsicle, right? But it contains alcohol, and there's so many things out there that are, that kids might not know, and parents also to be aware, because they know that it has alcohol, but little kids might not know, so they can explain to them that these are not for little kids, it's for adults. And there's been so many things going on in the past month that we have been trying to raise awareness, like a National Prevention Week that happened, and then recently the World No Tobacco Day. Also, we had so many things going on, and we're going to continue to try to raise awareness on different topics. But right now, we're trying to get kids involved in something, because a lot of them are just at home, and a lot of parents are working, and we want to make sure that they're busy, doing something, and they all need community service hours. So we're going to get them involved if we can, and we're planning it, like I mentioned, a summer camp, and it's going to be virtual. So if their parents are working, it's no problem. They just need to connect, and they can be part of the summer camp, and they can earn community service hours.
Okay, great. And that's actually what I was about to ask, if it was something that was going to be in person, or if it was going to be something that was going to be virtual for the summer camp and the community service hours. But you just answered that it's going to be virtual.
Yes.
Yeah. Well, thank you for that
Thank
information. Announcements or feedback on anything? If we do not, then we're going to go ahead and move over to our next agenda item, which is the community presentation. And we have Ms. Marta Hernandez, who is representing WestCare. And Mr. Walsh is going to be sharing her PowerPoint presentation, and she's going to be was a familiar face to most of us. She was at South Texas Development Council, and she assisted us in many grant opportunities. And so now she's in our community in a different capacity, and I'll go ahead and let her share that information with you.
Thank you, Ms. Colleen, and everybody. I'm very, very grateful that I'm having this opportunity to present on our program, and I look forward for any future collaboration. That I saw earlier today at the FACE Coalition, which was a very well productive meeting. And I would just like to give you a background of where I am now. I'm with WestCare Foundation, and it is a nonprofit organization, and it's with an S, organizations, because it does residential and outpatient environments. Now, so what does WestCare have to offer? It has services that include substance abuse, addiction treatment, homeless and runaway shelters, domestic violence treatment. Services are available to adults, children, adolescents, and families, which specialize in helping people traditionally considered to be difficult to treat, such as those who are indigent and have multiple disorders or are involved with the criminal justice system. Now, like I said, WestCare is among 16 states, and it also is included in the Republic of Palau.
Ms. Hernandez, give me a quick second. I don't think that the PowerPoint is on.
I thought you were going to do some background.
That's just the first slide, and it's just,
Okay, good. I'm going to start now.
Yes, it's just the first slide there. I haven't really moved into what program we have here in Laredo. There we go. Yes, I'm still on the first slide. And here, like I said, it's among 16 states, 3 U.S. territories to include the Dominican Republic and the Republic of Palau. WestCare Foundation headquarters is in Las Vegas. Let's see here. Okay. And WestCare Texas headquarters is in San Antonio. So I do report to San Antonio, and an extension office here in Laredo. Now, what programs do we have here in Laredo? We have the Drug-Free Community Support Program. Now here in the drug-free community support program, our funding source comes from the Office of the Drug Control Policy. And it also has an oversight of responsibilities, and we are also included with the CDC. And all of that is administered through the program. Now, the DFC grant award is up to $125,000 annually for up to 5 years, and with a maximum of 10. So this program only goes up to 10 years. So we try to make the most out of it, and we try to meet all the implementation efforts that it is required. So currently, the Laredo DFC program is on their 3rd-year cycle, and it runs to September 30th of 2020 through September 29, 2021. So the 3rd cycle will be coming to an end soon. And what does this program do? It helps to prevent youth substance use and addressing environmental conditions. Who do we concentrate on? 7th through 12th grade students. Next slide, please. The 2 main goals the drug-free community program goals concentrate on is to establish and strengthen collaboration among communities, public and private nonprofit agencies, and the federal, state, local, and tribal governments to support the efforts of community coalitions working to prevent and reduce substance use among youth. The second goal is to reduce substance use among youth by addressing the factors in a community that increase risk for substance use and promoting the factors that minimize the risk for substance use. These items here, you can just Google it, and you can put CDC, DFC support program, and it'll direct you into the CDC website, and it'll provide you a whole array of information there that you might need, maybe even for your projects, your grants, that you might need information. Next slide, please. Now here in this, in order for the program to work, it has to be in conjunction with a coalition. The coalition that the DFC has, it's the FACE Coalition, the Family Assistance Community Empowerment Coalition, which is a very well known since 2009, I believe. Yes, it was clarified today by Judge Liendo since 2009. And there were the founders within among the FACE Coalition, and many local providers that, started projects like SCAN and the Area Health Education Center. So all of this made up the FACE Coalition, and now the DFC is in conjunction with the FACE in order for this to work. Now, the FACE Coalition must have 12 representative sectors, as you can see there. The first.
Sorry about that.
I'm sorry, Martha, can you unmute yourself?
There we go. Can you hear me now? Yes. Okay. So it does have 12 sectors. Okay. And it has the youth, parents, business, media, schools, youth servicing organization, the law enforcement. It also has the civic volunteer organizations, the religious, healthcare professionals, state, local governments, and substance abuse organizations. All of these 12 sectors come together. And if you ever attended the FACE Coalition, you can see how they work. They connect together. They provide information of their local services. And that's how we are able to help the youth and also the families. And we're also able to come around and looking for the problems that the city of Laredo has. And this grant, basically, it focuses on the 78046 area, but we are extending to making sure that we get around the youth and also in collaboration efforts. And there in the map right there, you see our United States map. We're way down there in the South Texas. We're the only DFC program. And I'm very proud to say that we're able to have it here in our area. And we look forward to making it work. As our core measures, in order to help these youth, we concentrate on finding the alcohol, tobacco, marijuana, and the prescription drug misuse that is going on within our city. So as always, together as a coalition, they are driven by local conditions to implement local solutions that will build a safe, healthy, and drug-free community. Now, if we go over these core measures, how do we get data? We haven't gotten data yet. And a lot of impacts happened with the COVID-19, who did not have the impact. But as now I'm 4 months into this program, I'm getting ready to start to have those surveys going. We do have some surveys going now, channeling through the Area Health and Education Center there that they're helping, since they do have a big youth group, and we're getting some surveys done there. But throughout the summer, we're gonna make sure that I'm able to have a plan and get out there and get these surveys done. Now, I cannot just come up with a survey. So the West Care team do have evaluators that they have to make sure that these surveys are correctly well put and established. Then we also have to submit them to the CDC and get them checked off and approved in order for me to hit the streets and start getting these surveys done. The core measure survey includes past 30-day prevalence of use or non-use, perception of risk, perception of parental disapproval, and perception of peer disapproval. So those are the surveys that we're looking forward and planning to get it forward to start getting some data here. And I'm very happy to say that once we have that data going, I am more than happy to share with you all. That way we can come together and make sure we get these services out there where they're needed. Please, next slide. Now here are some of the program activities that we do, but we also have to implement the 12-month coalition action plan. It does consist of 7 strategies that we must implement in here in this program, and that's to provide information, the educational presentations, workshops or seminars, community meetings, town halls on youth substance use. So that is a big part of us, and making sure that the youth, the parents, and the community know how to be aware of this. Enhanced skills. Again, it comes down to workshops, seminars, and activities designed to increase the skills of participants, members, and staff regarding substance use prevention. Provide support for people to participate in activities that reduce risk or enhance protective factors associated with substance use in their community. For example, mentoring programs or support groups. The next one would be enhance access or reduce barriers. That's to improve the ease or the ability of and opportunity for community members to utilize systems and services providing substance use and prevention and treatment resources, or to reduce barriers that might impede utilization. For example, making sure that the information that we're providing, that it's in also English and Spanish. That way the information can be correctly outreach to the people that are in need. And the next one would be change of consequence. This is where a lot of the role play here we have with law enforcement. We really want to get the law enforcement agencies to be involved with us, would be the Webb County Sheriffs and the Laredo Police Department. And I'm so glad that I'm in connection with the Laredo Crime Stoppers. So here's where we can promote community practice that encourage positive organizational or individual behaviors to reduce the risk of substance use and resulting from harm, and to discourage behavior that increases the risks. And a lot has to do with the public recognition of business practices that reduce the risk of harmful substance use. Like, for example, when we have retail stores maybe selling to minors, or maybe they're not up in check with their licenses, vendor licenses, and we can come together and also help in that, in providing that information, getting the trainings done for all those vendors, and also letting the kids know that there's consequences when you have open containers, or you're trying to ride around in your car. And as right now, summer is here, And we do see a lot of the summer driving schools going around. A lot of the teenagers are excited about getting their driver's license, but it's also very important to, hold your license. And that is, something that you don't want to lose as a teenager. And also have change of physical design, features of the community environment to reduce the risk or enhance protection. Modify change of policy. Strategy involves engaging in activities to educate and inform the community concerning the effects of current and potential laws, rules, policies, and practices that influence substance use and the accompanying of harmful outcomes for the community. So those are the strategies that we must implement in our 12-month coalition action plan. And so far for our 2021 activities, from the start of the year of January through June, we have been meeting on a monthly basis with the FACE DFC Coalition meeting. That meeting is every first Wednesday of the month. January through May, we have had partnership with the Area Health Education Center, semi-monthly mental health awareness virtual seminars. Very, very valuable information that the AHEC has been bringing to our area. So I'm very grateful for that. In March, we did have a workshop for the United ISD and the Laredo ISD DFC. We came together, and for the licensed chemical dependency counselors, we did have 2 presenters from the UT GRV, and one was on self-image and self-confidence, and the other one was on marijuana, synthetic marijuana. So we had a training for them. So that was a very great opportunity. It was their 3rd series, and hopefully we're looking forward for the upcoming school year to provide another set of different workshops for the LCDCs of this community. In April, we collaborated with the Laredo District Drug Enforcement Agency to provide public awareness of the National Prescription Take-Back Day. And I also assisted throughout the event at the Laredo Fire Department site. It was such a great opportunity there. And we were able, I do have the results, we were able to collect out of the 4 sites included, we were able to collect 1,491.5 pounds of prescription medications of expired or anything that they wanted to disregard. And that was fantastic for our area. And also in April, we started a new partnership with the Area Health Education Center to provide the Bobin Life Skills training for the middle school and high school students. And May through June, I am currently working on getting trained for the certification myself for the Bobin Life Skills training for middle through high school and transition. And that certification is through the National Health Promotion Association. That Bobin Life Skills is the evidence-based prevention program for schools, families, and communities. It is designed to promote positive health and personal development for youth, which studies have shown that it reduces tobacco, alcohol, and marijuana use. So I very much look forward for any collaboration efforts with any of you all. And by all means, you're all more than welcome to join us at our FACE Coalition meeting that we have on a monthly basis. And Ms. Colleen, thank you very much for this time.
Martha.
Yes.
Okay, so I don't know if you're aware of the original coalition that we had many years ago when we were working on a triage center, and West Care was part of the lead for that. And
Yes.
Many years ago, I had brought in the people from West Care to Laredo. They were evaluating the project. Maurice Lee was the person I worked with. I worked with Dick also. And it's good to have you here. One of the things that I would like is Maurice is no longer here. Maurice used to know all the intricacies about what we wanted to do. They had the initial plans for the detox. And I think some of those plans were followed. It's a shame because we came so close and then that coalition fell apart. But, if you ever knew the story, I had co-written the grant for the West Care homeless. I did the clinical part, and Mr. Soares did the housing part. Laredo ever had. And that program eventually fizzled out, but Westcare was very integrally involved in our coalition, and I'm glad to see you here. And I want to see you, I obviously regularly. Richard and somebody else, whoever took over Maurice's position, whoever is now in charge, Maurice just one of our meetings, even on a smaller committee meeting, like the ones that we're going to have, and other people can be invited, because I think it's important to have Westcare, and they provide so much care all across the United States. They are major players in we're looking very strongly at getting a footprint here in Laredo. And of course, I'm very happy about what you're doing, but I would like to see how interested they're in, because be here. You've got to be here. And I'm glad that Westcare is here, because those RFQs are going to come out. One know what Westcare has done all across the United States. I remember when I met him, I was at an NADDCP meeting, and we had I was riding, and we were all having a discussion about how Westcare could come to Laredo. I'm glad that you're here, and to see someone from the executive team, even just on Zoom. They don't have to come to Laredo. I remember taking Maurice out and eating carne asada and, the whole bit, right? The place on Marseille, the previous Colleen, where they have all the spices, La India. Yeah, so we took them to La India. Maurice always would come down and have carne asada somewhere. But I think that it's important to bring Westcare back into the picture. And so if you could be in the meetings, with the executive team or whoever that took over Maurice's place, or even to let Dick know, hey, Jesse remembers you. Jesse, the triage, they met with the judges. And this effort has been more successful because it's been a grassroots project. Of the community, because of the members here. But I would like to in the United States, I think that we need to have them somehow involved in the community, even at a greater level that they're at. That's my belief.
Absolutely.
We can bring in 2-3 more different providers. We have too much work to do. We can bring in more agencies, and we're not a threat. We have to all work together. And so that's my message to Dick. That's my message to your boss in San Antonio. Let's see if we can just have a meeting, and that could be eventually part of this. More providers in here other than Scan and Westcare.
Got it, Mr. Hernandez, yes.
Great job. I'm very happy to hear from you today. Congratulations.
Yes, Mr. Arispe is our chairman right now, and
Well,
Calixto
I
is our
know.
that West Care is has been around here, and they used to have the Next Step. So yes, I'm so glad to be here and be a vessel to all of you, and making sure that we're able to connect and collaborate. I love to help the community, and this is a big priority as I love to make sure that even the smallest things can become big things.
So you know, you can let Jaime know, and you know, it can even go up to Steve and whoever else. We just so that you know that I can let you know. That even when my son was at Alexander, and this is many years ago. And for this particular type of project, for the triage, and it's a shame that it fell apart at the very end. The only people that were in at the very end, not in. At the very end, it was all, you know, it had all fallen apart. But I really always have loved the collaboration with Western.
Yes, and the DFC is one of our main programs. We do have another program, and it's drinking. And I don't have all the details right now because it's in the works, but I will be coming back and provide 21 Communities Talk. This is where we'll be able to have a different type of speakers, where we're able to come and have a town hall meeting, have a forum, and invite as many as we can. That grant focuses on underage drinking. So it's by SAMHSA. So I'm very grateful for that opportunity that we're going to come. Any presenters and agencies, that way we can get all the information out that is needed.
Yes.
Thank you.
Thank you very much, Ms. Hernandez, for your stakeholders the opportunity to present on what their agency is doing and how we can help them bring it up to the commissioner. While Ms. Veronica Jimenez also leads the Webb County Community Coalition, and now the FACE Coalition that has been around since 2009. Impactful in our community. You get to provide the information and education to having to bring it to our meetings is very important. These tasks, and I commend you all for actually doing this work and meeting together. And I think, you know, you all know Mr. Hernandez. We have to have that passion, that will to want to make a difference. And I guess, you know, I believe strongly that together we make the difference. So as cliche as that might sound, it is very true that this meeting, and as a matter of fact, for the next meetings we're going to implement, where our stakeholders are going to give us maybe the misuse of certain drugs or trends that are coming about, so that we're able to share to our police officers, that we're able to share to some of our to be able to hear the news and then be able to have it as elevator talk. I go in and I talk about, hey, did you hear? Did you know? And it's providing that education. And even if it's on a one-on-one, new to your position, 4 months in, but I'm excited to see what be part of these meetings. They happen once a month, and as a matter of fact, being part of the subcommittee will provide more education to our community and some of those numbers that we need to be able to tackle some of our problems here in our community. So thank you very much. Does any Okay. Thank you very much, Ms. Luca. Right now, we're going to go ahead and move forward to announcements. Do we have any announcements? Anybody would like?
All right. Good evening. I just wanted to mention that last week we met with city management and they went over a Of course, everybody has to take the Texas Open Meetings Act ethics requirements training, which I'll work with you, Colleen. You guys have done it before. As long as you can provide some sort of documentation to Colleen and me, that way we could have it on file. And on ordinance 2019-0-110, it does state that and any more than 4 regularly scheduled meetings that are missed in 1 year constitutes an automatic forfeiture of your board. Where we're at, and I guess keep moving forward. That way, everybody knows what's expected of them. That's all I have.
That training.
Okay.
I remember when I was initially put on the commission many years ago, and I was pulled out and I was pulled back in. I don't think I ever took that training. If you could please just send it to me, and I'll be happy to do it.
Mr. Walls. That generally everybody should take just as a refresher, even because there's no record of it.
I don't have any record right now, but and say, hey, this is what we're going to do as a committee. That's probably the best option.
And I think that's actually a very, very good idea, only because we're freshness as we are going to start changing it. It will officially be on the agenda, but I do want to take a discussion. Meeting virtually, or should we do hybrid where we do, the opportunity to do online and do in person, or should we go 100% in person? Should we do it during the day? Can I get some feedback from you guys just to kind of have an idea of what you all are comfortable with?
To be honest, I've always preferred it 5:30. I'm okay. During the day, once I get started, it's really hard. I have a different schedule, While I'm okay if we had to meet in person. I've been vaccinated, we have a room big enough. We could do hybrid, we could do what.
Very much. To share?
I don't mind staying at this hour virtually. That's fine with me. Whatever. Cool.
Got it. And I think virtual is very convenient. I guess we plug in anywhere. But we have had less attendance, so we abide by our commitment to the commission. So we'll make sure that we starting today, moving forward, that attendance is up to par and that we meet with the Texas Open certification or training. Moreno.
I'm available whatever time. If y'all want to keep it Wednesdays at 5:30, that's fine. I'll work my schedule around that. And either in person or virtually, it's fine with me.
Okay, got it. Thank you so much. Anybody else want to share? I know Chief Maciel had already said that he's open to anything and everything.
Yes. Colleen, this is Dora.
Yes.
I kind of like Wednesdays. 5:30 works for me. Virtually works even better
Okay.
because, I'm able to multitask as we all are doing multitasking, but I don't mind Wednesdays, 5:30.
Okay, perfect. I think everybody's doing okay with virtual, so we'll continue doing virtual. We'll make sure that we continue to do Wednesdays at 5:30. And the topics that we are, discussing, and to bring, information to these meetings so that they don't go down in vain, that we definitely are making a difference and an impact overall. So I appreciate you all for having to be in attendance today. Again, the format will be changing a little bit. Whether it's a stakeholder or somebody from the outside coming in to discuss on a topic that may be of interest to us, to kind of get our brains and our heart, moving into the right direction as we get ready for the detox facility meeting and producing some information to us. Are there any other announcements or any other comments?
I went ahead and put a comprehensive list of everybody. I'll go ahead and email that as well. But if you guys want to copy and paste it right now, it's available.
Got it. Thank you very much.
Right, for this meeting, it wasn't on my schedule, but if we can do that, the calendar invite, the one in Outlook.
I don't think that she did it through Outlook. Did you get the email from Paola?
Yeah, it was regular email.
Okay, yeah.
I know we had them scheduled like monthly. I think it was the first Wednesday of each month.
The first Wednesday of each
in our
month.
calendar. Mm-hmm.
Okay. I think maybe we can change the format at the next time. Paola did send out a meeting notice last week and then earlier today, 2 hours before. But I totally agree. I know what you're talking about. I have iCal. On that for the next meeting. For right now, the next meeting will continue to be moving forward on the first Wednesdays at 5:30. Let's just make sure that we don't have a holiday next month. No, we're good. Okay, so July 7th, 5:30 is the next meeting. So please save the date. And then, of course, if anybody has suggestions for a community presenter, or if any of our stakeholders are willing to present on their agency, you're more than welcome to let me know. That way we're able to put it into the agenda. And if anybody else would like to speak on anything, please let me know. But as of right now, if there are no other announcements, it is 6:27. I will entertain motion.
Second.
I had a first and a second. All in favor?
Aye.
Any opposed? Motion passes. We are adjourning the meeting at 6:27. Thank you very much. And I look forward to working with you all and seeing